pressure.
Hi, Nicole.
Hi.
My name is Dr. Matt. I'm going to do your chiropractic adjustment today. But first, I would really need to have a little bit of history to make sure that we know which part of the back is hurting you and if there is any immobility problems that we will address those. Do you have any history of car accidents, bike accidents, or anything like that?
I got in a car accident about 6 months ago.
Okay. And were you having any issues before that?
I've always had a little bit of back issues, but I've had more since the car accident.
Okay. And have you had any injuries to the spine, neck, or head?
It was a head injury.
Okay. Did you lose consciousness?
No.
Okay. And how fast was the recovery?
I recovered in about a month or so, 2 months.
Okay. Have you had any issues with walking after that?
No.
Okay. Any issues with moving your arms, your hands?
Just when I move my shoulders, I can feel a lot of tension in my neck and my upper back, and it can get a bit painful.
Okay. Do you like to sleep on the side, on the back, or on the belly?
I sleep on my side.
On the side. Okay. Is there a preference that you have?
I move around a lot.
Okay. Then what I can do is take a look at your gait, and then we're going to do a detailed assessment to see exactly where the immobility is. And then we're going to go ahead and do a plan so that we treat you today as well.
Sounds good. Thank you.
You're welcome. I'll have you stand up now. Okay, so go ahead and take a few steps. Just walk normally. I'm just taking a look at the gait. Keep on walking. Very good. A little bit of pronation on the right side. Your right foot is going. Keep on walking towards me, and then I'll have you turn around so that I can take a look at the back. Stop. Okay. All right. Is it okay if I palpate on the right side and the left side of the hip? Just taking a look here to see if there is any misalignment. Okay, your right hip is also moving a little bit forward, and that could definitely cause that misalignment in the spine. Any pain as I'm palpating on the right side?
No.
Okay, just going to check here the lumbar area and how it adjusts with the hip. Just feeling to see if there are any nodules or anything swollen that could be putting some pressure. Okay. Just going to keep on pressing here. With your right foot, go ahead and push it in like this in front. Any pain there?
Mm-mm.
Okay. Any pain as you're pushing down now?
No.
Okay. Let's go ahead and do the same thing on the left side. Any pain here?
No.
Okay. Now go ahead and try to touch the outside part of your knee with your left hand. Any pain there?
No.
Okay. Come back to center. We'll do the same thing on the right side. Okay. Left side is also a little bit tight here. We can definitely do an adjustment and see how that feels after. Okay, moving up to the spine. Okay, just going to put your hair here on the side, and just gonna feel my hands sliding on the left and right, looking for asymmetry and changes in temperature. I usually like to check this twice because it definitely gives a good understanding of the neuromuscular balance. Okay. Palpating scapula to see if there is any misalignment or immobility. Any pain here?
Mm-mm.
Okay. Any pain on the right side?
No.
Okay. And your pain is mostly upper, correct?
Mm-hmm.
Okay. Okay, so I'm gonna have you sit on the table facing the wall and I'll take a look at the upper back.
Okay.
Just going to slowly palpate, starting with cervical spine. Go ahead and look level, parallel with the wall, just trying to see if there is any abnormal curvature. And if I'm noticing any changes in symmetry. Looking for abnormal reflexes. Again, we're looking at the neuromuscular mechanism and how we can balance the nerve induction. Okay, slight movement at T2, T3. Okay, only on the left side. Okay, just listen to your spine. Just gonna have you, as I'm doing this, I'm gonna have you touch your chest with your chin. So slowly move down and then slowly move back up. Perfect. Okay, let's go ahead and do that again. Trying to see if there's any microscopic sounds that we can pick up with the stethoscope. I think there is a little bit of scratching that I can hear. And it was mainly here, the same point where it noticed the neurological impulses. Just going to listen to the sides. You can go ahead and relax your neck. Okay, go ahead and tell me if you feel this pressure or vibration.
Vibration. Pressure. Pressure. pressure, 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 vibration, pressure, 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 vibration, vibration.
Okay. So this is the second assessment that I'm doing to check for any neuromuscular imbalance. We're looking for deviations in temperature around the spine and at the spine level. Slight temperature at T1. Just going to mark the points that I will be focusing on and slowly move down. So these three vertebrae right here, definitely we need to create some alignment and increase spine mobility. That's going to help for the fluid to be released and for the inflammation to subside. There's a lot of inflammation here on the thoracic area. Okay. Okay, so it does look like it stops at the last thoracic. I'm gonna have you lay down and I'm going to start with a neck adjustment first. Okay, go ahead and relax. And I'll start by palpating your neck. Okay, there's a lot of tension here in the back. We do need to soften the tissue before we do any adjustment. The benefits are definitely 10 times more when we do that. I'm going to apply an anti-inflammatory oil so that we can apply cold therapy and decrease some of that inflammation here. It's going to feel a little bit warm. And in combination with the cold therapy, it's definitely going to bring down some of that fluid buildup and tension that has been building up around the vertebrae. This is going to feel a little bit cold. I'm just going to have you turn your head towards your right. Perfect. Just going to massage the carotid artery, moving to the sternocleidomastoid muscle. for just softening the fascia that connects from the lower part of your scalp with the neck. Moving to the other side, I'm just going to have you move your head that way. Perfect. And this is going to feel a little bit cold. Okay, I'm going to have you relax your head in my palms. Just going to kind of like do a wiggle test to see the movement. Okay, go ahead and take a deep breath in and breathe out. Good. And one more time. Very good. I'm going to switch to the arms. Just going to slowly apply gentle pressure. I'm going to use warm therapy here to soften the joints. Okay. These are warm medicine balls that help to release tension and decrease muscle tension in the shoulder joints. The muscles also relax. Go ahead and relax your arm. Just going to apply pressure here on the main points so that we release tension in the cervical and thoracic area. Take a deep breath in, breathe out. Very good. Just going to go ahead and release tension from the finger joints as well. This helps with collagen production. It really increases that joint mobility. Just finding the pressure here, the point that we need to release. Go ahead and take a deep breath in and breathe out. Perfect. Okay. Go ahead and relax your knee. Just going to see how the alignment is here on the right side of your body versus left. Okay, that's good. Doesn't seem to be overly pronated, but your right hip is definitely a little bit elevated. And looking at the malleolus, it's definitely more increased on the right side than left. So what we could do is to increase that joint space so that we allow for collagen production to be slowly released. That was very good. We're gonna go ahead and have you flip over on your belly. Kind of go just slowly pressing down at the lumbar region to see if there's any imbalance in the neuromuscular plexus. We're looking at the whole spine. First micro alignment that I want to do is right at these points where we noticed a change in the neurological temperature. This is considered a micro alignment. Go ahead and take a deep breath in, breathe out. How does that feel?
That feels good.
Okay. Okay. Going to apply an anti-inflammatory oil. It does help to release that tension and bring down inflammation. Going to be focusing on the middle part to slowly release. How is the pain?
It feels good.
Okay. It's going to feel a little bit cold, just applying pressure. Are you more tense on the right side than left?
Mm-hmm.
Just going to use cupping to increase circulation. going to do a slow adjustment here at the heel, since I did notice that you're having a little bit of pronation with the right foot. Just going to use gentle cupping to stimulate blood flow. Just going to feel like a gentle pressure. This helps to distribute blood flow evenly.
Hi.
My name is Dr. Matt. I'm going to do your adjustment today. How are you feeling?
I'm okay. Just a little bit tight.
Okay. We're gonna go ahead and do some adjustments, but first I would like to know a little bit about you and the history and what has happened. So I read in the file that you were in a car accident.
Yes.
Did you hit your head?
Yes, I did.
Okay. Did you lose consciousness?
No, I did not.
Did you go to the emergency room?
Yes, I had to go for a little bit.
Did they do a CT scan or an MRI to check for any bleeding?
They did, yeah.
Okay. And are you having any aches that are lingering from the accident?
My neck has just been feeling like really stiff, especially like on the left side.
Okay. Yeah, you might be having some symptoms of the accident, and that strain can be from the whiplash. So we can definitely do a soft tissue massage to see if we can decrease some of that fluid and increase your spine mobility. And are you feeling any kind of pins and needles in your fingers or your toes?
My fingers, a little bit actually, just like on the sides, around the base of them.
Any numbness?
Not recently, but I have experienced numbness in the
Okay.
past couple days.
Okay. And are you taking any medications?
None currently, no.
All right. Any other accidents prior to this one that was recent?
No, not that I can think of.
Okay. Do you have any broken bones or any surgeries?
No.
All right. And any shooting pain down the body on the back?
Yes, definitely down like the sides. I can definitely feel it. Not as much near the spine, I would say. Closer to the muscles on the outsides, like on my sides.
Okay. And is it radiating down your leg?
A little bit, yeah, especially on the left side.
Left side. Okay. And are you a righty or a lefty?
I'm a righty.
Okay. We can definitely check for any posture realignment to see if we need to do anything with that. So I'm gonna have you stand up and I'll have you walk and I'll examine your back to see if there are any imbalances.
Okay.
All right, Nicole, go ahead and take a few steps towards me. Just walk normal. Definitely seeing some inversion there. Go ahead and turn around. Take one more step. Balance, okay? Go ahead and keep on walking for me. All right, turn around. Come back towards me again. Okay, not so bad. I'm gonna have you turn around. I'm just gonna check your back now. All right, I'm just going to touch you with the back of my palms, okay? So we're looking for any changes in muscle tone. Are you feeling any numbness as I'm sliding down my fingers?
No.
What about here?
Mm-mm. A little bit.
On the right or left?
On the left side.
Okay. Okay, I'm gonna have you sit down facing the wall and I'm going to examine your shoulders now.
Okay.
I'm just going to go ahead and put your hair up in a bun. Okay. I'm going to open the gown on the upper side. So we're just taking a look at the spine. Okay. I'm not noticing any changes in temperature. Slight elevation at T1. Noticing a little bit of inflammation right in between the shoulder blades. So this is where the pain is, right?
Mm-hmm.
Okay, I'm definitely noticing a slight angle elevation at the atlas. What we need to do is just to increase blood flow to the area, and that usually allows for nutrients to be delivered to reduce inflammation. Also, we need to put the spine in a straight position, so we're going to do an adjustment that helps to increase spine mobility. I'm not noticing any signs of scoliosis. Usually in an accident like that, these can be aggravated. Are you having any pain as you're sitting down here?
Mm-mm.
Okay. I'm going to check scapula mobility, so just gently palpating around it. We're looking at the soft tissue. It's definitely very tight, so we want to work on that as well. Okay. Right side the same. Alright, I think I'm going to have you lay down first. So we're going to start with face up. We're going to work on the neck muscles and then we're going to flip over. Okay. I'm going to go ahead and palpate your neck. So we're looking at cervical spine. Soft tissue is very tight. We're going to need to make sure that we are reducing some of the tightness that I'm feeling right here and on the left side and right posterior to the neck. Just warming up the oil in between my palms. We're doing gentle stretches here. Taking deep breaths in definitely helps to increase lung capacity and deliver oxygen to the brain. I'm going to apply gentle pressure here. So we're starting to work on soft tissue. I'm going to have you take a deep breath in and breathe out. Excellent. Okay, that feels very good. So we're gonna work on your arms now. I'm going to go ahead and do an adjustment on the shoulder and arm. So go ahead and take a deep breath in and breathe out. Good. And we're going to adjust your knuckles as well. We'll do the same thing on this side. Go ahead and take a deep breath in and breathe out. Good. Okay, perfect. Now we're going to make you a little bit taller, so we're going to work on your legs as well. Yeah, just looking at the length here. So we're going to do the same thing. Breathe in and breathe out. Good. And same thing. Breathe in. Breathe out. Perfect. And now I'm gonna have you put your arms around you like this. So I'm gonna have you flip a little bit on your right hip and bend this knee. Keep this one straight. All right, perfect. And take a deep breath in as you're holding your arms around you. Okay, perfect. So I'll do the same thing on the other side. Excellent. Breathe in, breathe out. Good. Perfect. I'm gonna have you flip over now. Okay, we're going to do a little bit of skin pulling. So it's going to feel kind of like a skin pulling. And just a little bit of release here. Did that hurt? Okay. To apply some anti-inflammatory oil. This will help to decrease inflammation. I'm working on the paraspinal muscles. They are definitely very tight, and that can cause a lot of strain on the neck muscles. Using these warm medicine balls to help release the inflammation. I'm going to be using a gentle cupping, and this still helps to increase circulation. So I'm going to target the paraspinal muscles. And just make sure that you do breathe through all of these exercises. We want to make sure that we're delivering oxygen to the cells. Going to apply a little bit of oil on the lower part of your leg. Sometimes the calves can be very tight as well, especially when there's an imbalance in the spine. Going to work on the lymphatic drainage. I'm seeing that there's a little bit of swelling. Okay, I'm gonna have you take a deep breath in and slowly exhale. Good. Okay. Perfect. All right, Nicole, how are you feeling?
I feel way better. So much better.
So I did see that your muscles on the back are very, very tense. And I did not go too hard, but definitely on the second session, we can increase the strength that we're using so that we really go in deep to the knots. You do have like a straight spine, so I'm not worried about any deviations. Now I'm gonna ask you to try to not go to the gym for the next week or two so that we can give your body a break, especially from the accident since it's so recent. And I just want to make sure that the spine stays in a straight alignment.
Sounds good.
Do you have any questions for me?
No, that sounds great. Thank you so much.
You're welcome. It was very nice to see you again.
Very nice to see you too.
Hi, Nicole. My name is Dr. Mad. I'm going to do your gynecology exam. So it's the first time here at our Women's Health Clinic, correct?
Yes.
Perfect. I have here a new patient intake form, and I'm going to ask you just a few questions.
Okay.
Can you please verify your first and last name and your date of birth?
Nicole Smith, January 7th, 2000.
Okay, perfect. Do you have a preferred pronoun?
She, her.
Perfect. And the reason for the visit is your annual checkup, correct?
Yes.
Perfect. I'm going to ask you some questions, and then we're going to start the exam.
Okay.
And what is your sexual orientation?
I'm bisexual.
Okay. And the sex that you were assigned at birth?
Female.
And gender identity?
Female.
Perfect. Any recent exams that you've had, like a pap test, a mammogram, colonoscopy?
No.
Okay. A pelvic ultrasound? Or a bone density study?
No.
Okay. What's the date of your last menstrual period?
It was about a week ago, so.
So like the second, third? Okay. Age of your first period?
14.
And how long does it usually last? How many days?
4.
And how many days in between?
They're pretty regular on the monthly cycle, so I'd say about like 3 weeks in between.
Perfect. Do you have a history of ovarian cysts?
No.
Fibroids? Any abnormal pap tests?
No.
Sexually transmitted infections?
No.
And have you ever used oral contraceptives? Okay, what about hormone replacement therapy?
No.
Are you sexually active?
No.
All right, any pregnancies? All right, are you taking any medications on a daily basis?
I take birth control.
For how long have you been?
I've been taking birth control for like 3 years.
Do you have any allergy to medications? All right, any history of asthma?
Yes.
How old were you when you diagnosed?
I was 11.
Okay. Are you taking any medication for that?
No, I just have an inhaler just in case.
Okay. When was the last time you had to use it?
I would say about 3 months.
And how often do you use it?
Very infrequently, maybe about 3 to 4 times a year.
Okay. Any history of cardiac disease? Diabetes?
No.
Hypertension? High blood pressure?
No.
Cholesterol?
No.
Okay. Osteoporosis? Thyroid disease?
No.
Okay. Reflux? Any pain?
No.
Anxiety, depression, or bipolar disorder?
I have anxiety.
Was it diagnosed?
Yes.
Are you taking any medication for that?
No.
Okay. Any history of panic attacks?
Occasionally.
Okay. How long ago was the last one?
About 3 months ago.
And how often do they occur?
Very infrequently, maybe about 4 times a year.
Okay. And do they usually resolve on their own, or do you have to go to the urgent care?
I resolve them on my own.
Okay. All right. Any surgical history?
No.
Any family history of breast disorders, ovarian disorders,
No.
prostate, pancreatic, or colon?
Not that I know of, no.
Okay. And mother and father are living?
Yes.
Any siblings?
I have 2.
Okay. Do you exercise?
Yes.
How often and what kind of exercise do you do?
I would say about 5 to 7 days a week. I do weightlifting and I'll do cardio about 3 days a week.
That's very impressive. Very good. Okay. Do you smoke?
Yes.
How many packs a day do you smoke?
Not tobacco.
Oh, okay. Got it. And how often do you smoke?
Maybe once a week.
Do you drink alcohol?
Yes.
How many drinks per week?
Maybe 3.
Okay. Are you experiencing any of the following symptoms? So I'm going to go over by system. Any eye problems? Do you wear contacts?
Yes, I do.
You do. Okay. And any vision changes?
My left eye's been a little bit blurrier than my right eye.
Okay, we're going to check that. Any problems with your ears, nose, or throat?
My ears feel good. My nose feels good. My throat's been a little swollen, but nothing painful.
How long has that been going on?
Maybe just like past day or 2. Might be a little bit of seasonal allergies.
Okay. Any respiratory problem like wheezing, cough, shortness of breath?
I had a cough about a week ago.
And do you still have it? Did it go away?
No, it's pretty much gone.
Okay. All right. Any GI problems like nausea, vomiting? Any urinary problems like painful urination? Any urgency or frequency?
No.
Have you noticed any breast pain or nipple discharge?
No.
Any neurological problems like fainting, seizures, numbness?
No.
Trouble walking?
No.
Okay. And lastly, have you experienced any easy bruising?
Yeah, a little bit.
Okay. Abnormal bleeding, like you would, let's say, cut yourself and the bleeding would not stop if you put pressure on it. Okay. Have you noticed any swollen glands on your neck, armpit, or groin?
No.
Okay. And any weakness in your arms or legs?
Not necessarily, no.
Any pain with walking? No. Okay, perfect. So we're gonna go ahead and start the exam. Just going to sanitize my hands here. And this will go on your forehead. So I'm going to take your temperature, 96.8. We just need to have a baseline since this is the first time that you are in our clinic. Okay, so I'm just going to have you relax. Blood pressure is normal, 108/60. Okay. I'm going to put this on your index finger. So this measures your oxygen and your heart rate. Okay, go ahead and relax your finger. Perfect. All right, I'm going to put gloves on and I'll take a look inside your throat since you said that you felt it was a little bit swollen. Have you noticed any burning sensation on the tongue or the upper side of your throat?
Mm-mm.
Okay, go ahead and give me an ah. I do see a little bit of redness, but it just looks like a viral infection. Okay. I'm going to check your vision as well, since you did say that your left eye has a little bit of blurriness. People are prone and reactive to light, so that's very normal. I'm going to have you cross the Snellen chart, so this is pretty basic. We're just going to check your vision. Go ahead and hold it with your right arm. It's fine. I'm going to have you keep this straight. Now, cover your left eye. Perfect. And can you tell me what letter you see here?
D.
What about here?
B. L.
So go ahead and read the last row, starting with the first letter to the left.
L. T. F. P. H.
And what color do you see here?
Red.
And here?
Green.
Okay, that's very normal. Let's go ahead and switch eyes. So go ahead and have this arm straight. That's good. Can you tell me what letter you see here?
F.
And here?
O.
Here?
E.
Go ahead and tell me what letter this is.
H.
Can you read the last row, starting with the first letter to the right?
H. B. E. I. L.
And what color do you see here?
Red.
And here?
Green.
Okay. So I do want you to get a vision check. We have an ophthalmologist that can definitely see if you need a prescription in your contacts. Okay. And they can also do like a further eye checkup to make sure that there are no signs of any vascular problems.
Thank you.
I'm going to go ahead and listen to your heart. Okay. Is it okay if I open the gown on the side? All right, I'm going to have you relax. I can hear only S1, S2, no S3, no S4. I had to listen with the bell now. Can you take a deep breath in and hold it for 3 seconds? Hold it for 1, 2, 3. Breathe out. Okay, I could not identify any murmurs, so that's really good. Go ahead and check your lungs. Can you take a deep breath in? And exhale. Good. One more time. Breathe in. And exhale. Okay, perfect. Okay. All right, and you said you're not having any chest pain. All right. I'm going to check for any leg swelling. Okay, I'm not noticing any edema. Perfect. And I'm going to palpate your pulses right here on the side of each wrist. Okay, very good. Alright, so what I'm going to do now is I will do the breast examination. So there are 3 parts of the gynecology exam. One is the breast assessment. We're looking for symmetry to see if there is any lumps or any redness. And then we also palpate to make sure that there are no nodules or lumps. After that, I'm going to do an abdominal exam plus a pelvic exam. After the pelvic exam, we're going to do a vaginal examination. That's when we do a pap test and also look for any polyps or any abnormal discharges.
Okay.
All right. So what I'm gonna have you do, so I'll have you open the gown here on the left side, and I'll palpate slowly to see if we see anything concerning.
Okay.
Okay. So let's go ahead and open the gown on this side. I'm gonna have you relax, okay? Alright, so I'm not noticing any abnormal asymmetry. It looks like there's normal color. And I'm just going to slowly palpate in a circular motion, okay? Also, let me know if you feel any kind of pain. I'm not feeling any lumps on the left side. Okay. Moving to the right side. Okay, at 11 o'clock there is a pea-sized nodule. We're just gonna keep an eye on it because it is very soft, so it might be just fluid filled. They usually go away on their own during the cycle. Okay. I'm gonna have you lay down and we will examine your abdomen now. Okay, Nicole. Let me know if you feel any kind of pain, but first, before we disrupt anything, I would like to listen to the abdomen. It's gonna feel a little bit cold. Did you have anything to eat recently?
Mm-hmm.
Okay. So this sounds like a normal digestion. I'm going to percuss. Let me know if you feel any kind of pain. Okay. Now I'm going to palpate. Let me know if you feel any tenderness or pain as I'm doing this. Okay, palpating the uterus to see if there is any swelling. And ovary on the right side. And left ovary. Okay. I'm going to take some measurements. I'm looking for abdominal distension. We're also checking level of hydration and nourishment. Okay, that's a healthy BMI. Now I'm going to go ahead and do the vaginal exam. So I'm going to lower the gown a little bit. Good. Okay, Nicole, are you comfortable?
Mm-hmm.
Perfect. So at any moment, let me know if you feel any kind of discomfort.
Okay.
I'm going to explain everything that I will do before I do it so that you're prepared and know exactly the points that I will be touching, okay?
Okay.
And if you feel any kind of pain, again, just don't hesitate to let me know.
Thank you.
I'm going to start by visualizing first. So I'm looking at the uvula to see if there is any redness. I'm not noticing any discharge. Now, I'm going to use a speculum here. This is going to feel a little bit cold. So the speculum, what it does is it opens the vaginal canal so that we can visualize the cervix. And it's very important to visualize the cervix to see if it's healthy or if we need to do any further testing. All right, on the count of 3, you're going to feel the speculum. Just go ahead and take a deep breath in. 1, 2, 3. All right, and the speculum is in. Now I'm going to collect the first swab. So this one tests for cervical disorder. So we're going to do a pap test. Okay, you're going to feel kind of like a pinching sensation. And what it does is that we're going to try to remove some of the cells that are on the cervix wall so that we can test them under the microscope. Okay, cervix looks normal in color. I'm not visualizing any polyps. And on the count of 3, I'm going to ask you to take a deep breath in and breathe out. 1, 2, 3. Alright, so that was the pinching sensation that you felt. You might notice a little bit of vaginal discharge after this. It is definitely normal. And I'm going to send this to the lab. And the last test that we're going to do, this one will not hurt at all because we're not touching the cervix anymore. So this tests for any STIs. And you're just gonna feel kind of like a touching sensation on the canal of the vaginal canal. And that was all. We're going to go ahead and send this to the lab. Are you experiencing any discomfort right now?
Mm-mm.
Okay, that's perfect. So I'm going to go ahead and close this. You can go ahead and get dressed and we can talk about the results, okay?
Okay.
Everything looks very good. We're going to go ahead and send the test to the lab and we'll have the results back in about just 7 days. We're going to give you a call with the results, and if you have any questions in the meanwhile, just let us know, okay?
Okay, thank
All
you.
right. You're welcome. It was very nice to meet you. Thanks
Nice
for
to
coming
meet
in.
you too. Thank you. Hi, Nicole. I'm going to take a look at your scalp and check your ears to see if we need to do any cleaning.
First, I'm just going to slowly palpate. I'm looking for any nodules or signs of inflammation around the earlobe. Color looks normal. Not seeing any lumps. Maybe just one, very little right here. Seems to be harmless. Noticing a little bit of debris in one of the earring holes. Can definitely clean that. First, I'm going to just slowly touch it and try to clean the skin. The spray has antiseptic properties. It helps to reduce bacteria. Now I'm applying a cleansing foam, so it's going to feel a little bit wet. That looks very good. So we're just cleaning the skin to make sure that there is no debris. That's very good. Just breathe through. Take deep breaths in. That usually helps. Okay. And now we're going to clean the left ear as well. So first I'm going to use antiseptic solution. It neutralizes bacteria. It has also antiviral properties, mint and eucalyptus. Okay, that's lovely. Now we're going to use the same cleanser. It's going to feel very foamy and a little bit wet. Okay, that's good. I'm going to go ahead and check your scalp next. Looking at hairline. Noticing a little bit of alopecia on the side, which can happen after a certain age, and it seems like it's not very advanced. What we could do is to prescribe some medicated oil that helps with hair growth and regeneration. I'm not seeing any redness going towards the right side of your scalp. I'm going to use a wooden spatula to better inspect the scalp texture. Scalp is definitely on the healthy side. I'm not seeing any signs of vitamin deficiency. But the hair definitely breaks easily, so it's prone to damage. Do you usually wear your hair in a ponytail?
No, but I used to when I was a kid.
I definitely don't recommend wearing it in a ponytail, at least not a very tight one. That usually damages the hair even more and puts a lot of mechanical strain on it. Have you noticed any itchiness on the right side, right above your ear? Okay. I'm gonna have you flip over and I'm going to take a look at the base of your skull.
Okay.
Okay, so first I'm just going to brush the hair towards me. And I'm going to take a look at the scalp. I'm gonna look for any lumps or bumps or scars. Okay, definitely noticing a white spot. It seems like it's also a little bit of alopecia. It's right on the right side of your scalp. But so far I'm not seeing any redness. It does seem to have a stronger texture towards the hairline. I'm going to do a few tests here to check the skin integrity, since there is a little bit of rosiness, and I just want to make sure that there is no eczema. Okay, we can apply an anti-inflammatory oil. It's going to help to stimulate blood flow in this area. It has vitamin D infused properties. And we're applying the oil directly at the scalp and base of the hair to make sure that it is easily absorbed through the dermis. You're going to feel kind of like a warm, fuzzy sensation. That's going to be localized just where we applied the oil. Okay, I like the texture now. Noticing one small raised papule. It doesn't seem to be infected. Usually we would be worried about a cluster of them, but since it's just one, I'm going to keep an eye on it. Small spider angioma. Noticing one more. They seem to be small in size, circular. There's no need to do any tests. Okay, I would like to do on this side a massage to help stimulate blood flow. You're gonna feel small pulsations. This helps to adjust the cranium and bring balance to the bone structure. It also helps with spine realignment and to fix cervical neck posture. Going to apply pressure point therapy on the occipital lobes. going to work on the lymphatic drainage as well. I'm going to apply a little bit of oil here on the neck muscles. I'm going to apply some acupressure therapy. This will help to relieve the inflammation at the base of the skull. Let me know if it hurts, okay? I'm not seeing any edema, which is a good sign of lymphatic drainage that is functioning properly. Okay, we're finalizing the treatment for today, and on your own time, I'm gonna let you open your eyes and you can take a deep breath in to allow for oxygenation to enter your whole body. I'm going to go ahead and try to fix your curls first. Just taking a look to see exactly what kind of product we would need to apply. Okay, so first I'm just checking to see exactly the quantity. Okay. Alright, so we're going to do a curl spray first. It's called Dream Coat for curly hair, and it's a moisture mist, so it's gonna give it a lot of volume. Okay, go ahead and relax. Okay. And then we're going to apply an air dry cream. It's sulfate free, so it's almost like a butter. I'm going to start with very little product. And I'm going to try to define your curls. Okay, so how does this look?
Good.
Good. Okay. Are you using any special products usually?
Yeah, usually I use a leave-in conditioner. I use a curl cream and a light gel.
Okay, yeah. That usually helps to fix this type of curls. And I'm noticing that you're not having any color, which is great. It's definitely a little bit tangled. We had to fix that. And what kind of makeup would you like for today?
Just something natural.
Okay. I have the right colors in mind for you, so I think you'll love it.
Gotcha.
Okay, I'm going to start with a glow serum. So we're going to use a few pumps. Since you want something very natural, I think we're not going to use any eyeliner. So just a little bit of contouring, concealer, and mascara. Okay, we have a touch of moisturizer. Okay. apply just a little bit of concealer. Go ahead and close your eyes. And open. Close. Keep it closed. And go ahead and close your eyes. Okay, now open. Look up. Perfect. Okay, we're going to do a little bit of contouring. So we're going to start with the cheeks. Perfect. And now we're going to be using a special brush to be able to do the contouring a little bit more effectively. Okay. Definitely you don't need much. It's always good to go upward towards the hairline. So we're creating some depth here. Perfect. And the last line. Okay. Going to go ahead and fix your eyebrows. So I usually like to fluff them upwards. I'm going to give it a little bit of color. We're going to use Roller Lash by Benefit. I love this mascara. It's very gentle on the eyelashes and very effective as well. Go ahead and look a little bit down. Perfect. So I'm going to try to give it lots of volume since we are not using any type of eyeliner. Keep on looking down. Okay. Now go ahead and just look a little bit higher, maybe over here. Perfect. Good. Okay, I'm going to use lip glow oil. I love how it looks on your lips. It looks very good. Okay, go ahead. And I'm just going to use a setting spray to make sure that the makeup lasts a long time.
Okay.
And it's perfect. All right. Let's go ahead and take a look at your hair and see if we can do any final touch-ups. Okay, what do you think?
Looks really good.
Yeah, I think I like it too. So, yeah, I'm glad you like it.
Okay, thank you so much.
You're welcome. Hi, Nicole.
Hi, nice to meet you.
Nice to meet you too. My name is Dr. Matt. I'm going to do your exam. Can you please verify your first and last name and your date of birth?
Nicole Smith.
Okay.
It's August 26th,
Mm-hmm.
2002.
Okay. Do you have any allergies?
I am allergic to wheat.
Okay. And when was your last checkup?
I had a checkup about, I would say, maybe about 14 months ago.
Okay. Is there anything in particular that you would like me to address today?
I've had a little bit of like a headache and it hasn't really gone away for the past month or so.
Okay. Any changes in your diet?
Not that I can recall.
Okay. Are you taking any birth control?
No.
Are you taking any medications on a daily basis?
I do not take any medications.
Okay. And if you take Tylenol or ibuprofen, does the headache go away?
For a little bit it does, yeah.
Okay. So we're going to do a checkup, make sure that you're not having any migraines. And if you do, we're going to prescribe some medication that can help with that. Have you noticed any heart palpitations, any chest pain?
I'll get a little bit of chest pain sometimes.
Okay. We get chest pain very serious, so I'm going to go ahead and do a very thorough heart checkup. Any respiratory problems? Do you have trouble breathing sometimes?
No.
Okay. Do you wear contacts or glasses?
I do wear contacts.
Okay. When was your last eye checkup?
I would say about a year and a half ago.
Okay. Okay. And do you have trouble seeing right now?
No.
Okay. Do you have any blurry vision, any double vision?
I would say my right eye is a lot more blurry than my left.
Okay.
I definitely need to get that looked at.
Okay. We can definitely take a look today and see what's going on. Have you noticed any skin problems, any redness, any itchiness?
Not really, no.
Okay. Any back pain?
I've had a little bit of back pain, yeah.
Okay. Is it more upper or lower side or middle?
Around the middle of my back.
Middle. Okay. And on a scale of 0 to 10, how would you rate that pain?
Like a 5.
Okay. Is it constant or it comes and goes?
It comes and goes.
Okay. And when would you say that it's the worst? In the morning, in the afternoon?
Probably in the morning.
Okay. Does it hurt when you lay down?
Yeah, in certain positions.
Okay. Okay. I think we have almost everything. Any surgeries in the last 5 years?
I got my wisdom teeth removed.
Okay. All 4?
Yes.
How long ago was that?
2 years ago.
Okay. Do you smoke?
No.
Do you drink alcohol?
No.
Okay. Okay, I'm going to go ahead and put gloves on. And we'll start with vital signs first. This will go on your index finger. I'm going to measure your heart rate and oxygenation. Go ahead and relax. Then, have you noticed any flu-like symptoms?
No.
Okay. I'm going to put this under your tongue, okay? Can you hold it with your other hand, please? Mm-hmm. Perfect. All right. Heart rate is 65, oxygenation is 97. And let's go on and check that. 97.4 Fahrenheit. Okay, let me go ahead and grab that. That's very good heart rate, especially when resting. So let's go ahead and try this arm. It's a little bit closer to me and that should do good. Okay, go ahead and relax your arm. I'm just going to put this right here. Perfect. Okay, blood pressure is 110/60. That's very normal. I'm just going to slide this down. Perfect. Okay, so I'm gonna have you sit down on the table and I will start the exam. Okay, so I'm going to go ahead and listen to your heart. Go ahead and relax for me. Just going to move the hair to the side. Good, I can hear at least one S2, no S3, no S4. Going to listen with a bell. So we're looking for any murmurs. Make sure that there are no signs of heart failure. Okay, go ahead and take a deep breath in for me and breathe out. And again, take a deep breath in and breathe out. Okay, very good. So I know you said you have some difficulty, blurry vision with your right eye. Go ahead and cover your left eye. And let's go ahead and start with the lower row. Can you read the first letter starting with the left?
L T F P H.
Okay, so that's pretty good. Can you tell me what color this is?
Red.
And what about this one?
Green.
Okay, go ahead and switch eyes. And can you read the last row starting with the first letter to the right?
H P F T L.
And what color do you see here?
Green.
And here?
Red.
Okay, so that looks pretty good. Let's go ahead and check your optic nerve. I'm going to have you look behind me straight at the wall. I'm going to flash a light in your eye. I'm going to take a look and make sure there is no inflammation. Try to keep your eye open as much as you can, okay? Okay. This eye looks really good. Let's go ahead and check your right eye now. Look straight behind me on the wall. A little bit of redness behind the retina. But I'm not seeing any scratches. Okay. Go ahead and look right here for me. Any pain there? And look here. Any pain there? Okay. Okay, go ahead. Look straight at my nose now. I'm just going to flash a light in your eyes. We're checking pupil constriction and dilation. Okay, so I'm going to press down. I'm looking for any yellowish discoloration. Everything looks very good. Okay, I'm going to check the back of your throat. Go ahead and give me a big ah. See, very good. Uvula midline. I'm not noticing any redness. Can you go ahead and stick your tongue out and push it up and down for me? So we're looking at muscle coordination, left and right. And can you push with your tongue inside your cheek? And the other side. Okay. Can you give me a big smile and a frown? Puff your cheeks. Very good. Keep them puffed for me. Don't let me unpuff them, okay? Okay, very good. Go ahead and lift your eyebrows up. I'm going to try to push them down. Don't let me do that. Keep them up. Keep them up. Okay, good. Now go ahead and close your eyes. I'm going to try to open them. Don't let me do that. Okay, very good. I'm going to try to push your head towards your right. Don't let me do that, okay? Good. And we'll do the same thing on the other side. Okay. Now I'm going to put my hands on your shoulders. Go ahead and shrug your shoulders. Very good. Relax. And can you squeeze my fingers? Squeeze them harder. There you go. Okay, perfect. Okay. So let's go ahead and check your ears. Have you noticed any drainage, any fluid leaking, any redness, any difficulty hearing? Okay. Go ahead and look that way for me. Okay. Looking for any signs of infection. It's actually kind of difficult to visualize the tympanic membrane on this side. Okay, tympanic membrane is broke gray. Oh, since you're not having any kind of pain, I'm assuming that there's no ear infection on that side either. All right, I'm gonna have you lay down now and I will take a look at your face and palpate your neck. Okay, I'm going to go ahead and start by palpating your face. I'm going to touch right under your eyes. We're checking sinuses. Let me know if you feel any kind of pain as I'm doing this. Looking for any swelling. Good. Now I'm going to touch the sinuses above your eyebrows. Any pain here? Good. And checking the lymph node right in front of your ears. These are the preauricular lymph nodes. We're checking for any swelling or tenderness. Okay. Moving down postauricular lymph nodes, below and a little bit under the earlobe. Submental under the chin. Okay. We're going to palpate mastoid bone behind the ear, looking for signs of mastoiditis. I'm going to palpate the scalp as well, looking for any swelling. Head is normocephalic. I'm not feeling any bumps or lumps. Checking the occipital lobes for any swelling as well. And right above the clavicles. Okay. Checking trachea to see if it's midline and if I'm feeling any kind of nodules on the thyroid gland. Can you go ahead and swallow for me? Good. One more time. Trachea is midline. I'm not feeling any lumps on the thyroid gland. Actually, it's non-palpable, so that's a very good sign of healthy gland. Okay, checking the rest of the face for any swelling or tenderness. Okay, checking nose for patency. Go ahead and breathe in, breathe out through your nose. Breathe in, breathe out through your nose. Good. Okay, so I'm going to go ahead and do a scalp check. Okay. Okay, scalp looks very good and healthy. Try to check for any sensory loss. Can you please tell me if you feel this sharp or dull?
Dull.
And does this feel sharp?
Yes.
What about now?
Yes.
Okay, does this feel sharp all the way?
Only at the end.
Okay. What about now?
Yes.
Okay, I'm not seeing any dandruff. There is no redness. Good. Go ahead and tell me if you feel this sharp or dull.
Sharp.
What about now?
Dull. Sharp. Sharp.
And does this feel cold or warm?
Cold.
What about now?
Cold.
Is it sharp or dull?
Dull.
What about now?
Sharp. Sharp. Dull. Cold.
And now?
Cold.
Okay. Okay. Does this feel sharp all the way?
Yes.
Okay. Does this feel sharp or dull?
Sharp.
And now?
Sharp.
Does that feel dull or sharp?
Dull. Dull. Sharp. Dull.
Does this feel cold or warm?
Warm.
And now?
Warm.
Okay, a little bit of sensory loss on the left side. Definitely something that we can investigate. Okay. I'm not seeing any signs of alopecia. Hair is evenly distributed, but I would definitely recommend maybe a multivitamin or something for hair, nails, and skin. It definitely helps to give it extra strength. But so far, scalp looks very healthy. Let's go ahead and check your abdomen now. I'm going to go ahead and first listen to your abdomen. This is going to feel a little bit cold.
Okay.
Bowel sounds are normal. Okay, I'm going to percuss. Normal percussion sounds. Now I'm going to go ahead and start gentle palpation. So we're looking for any organ enlargement. Let me know if you're feeling any kind of pain or discomfort as I'm doing this. Okay, I'm going to slide my hand right under your belly, and now I'm going to slowly push down. Any pain there? Okay, and also the same thing on the other side. So we're checking both kidneys to see if there is any kind of inflammation. Okay, and now I'm going to slowly palpate and see if there is any inflammation around the ovaries. Okay, very good. Now I'm going to go ahead and ask you to turn around and we'll check your back. Look for spine alignment. Okay, I'm going to go ahead and start by palpating your spine. Let me know if you feel any kind of pain as I'm doing this. I'm looking for any skin lesions. Okay, we're going to send this to the lab. Taking spine measurements to see if there is any asymmetry. And there's about a 10-degree difference there. Just going to take a few more measurements. So we're looking for the level of hydration and nutrition. Also, we're looking to see if there's any vitamin deficiency. Okay. Go ahead and take a deep breath in for me. And exhale. And again, breathe in. And breathe out. One more time, breathe in. Breathe out. And again. Good. So I'm not seeing any signs of scoliosis, something that would definitely explain why you're having mid to low back pain. What I'm thinking is that it might be muscular and maybe a strain. We can definitely prescribe some physical therapy that will help with the pain. So let's go ahead and check your reflexes. I'm going to ask you to relax your jaw. Good. And now I'm going to go to the shoulder area. Very good. Go ahead and relax your arm. Good. Go ahead and relax. Good. Okay. Relax. Okay. Okay, so just relax. Good. Okay. Go ahead and cross your legs. Good. Okay, perfect. All right, so I think we have everything. I'm going to ask you to go to the lower level. That's where you'll get your blood work done, and we will set you up with my chart. You're going to be able to access everything online, and if you have any questions, just go ahead and send me a message, okay? Otherwise, I'll get back to you with the results. Okay, and I will insert everything electronically to make sure that the next doctor will have the medical records for you. All right, do you have any questions for me?
No, thank you.
You're welcome. It was very nice to meet you.
Really nice to meet you too.
I'll see you soon.